Good evening, guys. For today's discussion A, we're discussing the stages of CKD for you all. So this falls under healthy aging for me, for elderly. So here we go with the presentation. Based on the content from the Mega Center, Kidney Center article, the 5 stages of chronic kidney disease, or CKD, are defined by how well the kidneys filter water or waste, measured primarily by estimated uh, glomerular filtration rate, or EF, or EGFR, and urine albumin to creatinine ratio, or UACR. Here is a breakdown of each stage along with typical symptoms and clinical insights. Okay, stage 1, mild damage, normal function, EGFR 90, normal filtering ability. 2 is UACR 30, indicates kidney damage, often asymptomatic, detected incidentally via blood or urine tests or imaging for other conditions. Okay, early markers like high blood pressure may appear. Okay, stage 2, mild decline in function, EGFR 60-89, still relatively normal function, but filtering is slightly impaired. May begin to see swelling in the hands or feet, or more frequent urinary tract infections. Still potentially symptom-free for many. Stage 3, moderate impairment, split into 3s, 3As, and 3Bs. Stage 3A, EGFR 45-59. Stage 3B, EGFR 30-44. Symptoms start to show: fatigue and dark foamy urine, swelling muscle cramps. Okay. Changes in urination, lower back pain, itchy skin, and sleep troubles. Okay. This stage marks a critical window to prevent further progression through lifestyle changes and treatments. Stage 4, severe decline. EGFR between 15 and 29. Kidneys are significantly damaged. Toxins build up in the blood. Okay. Common complications. Let's see. Anemia, high blood pressure, heart problems, mineral imbalances like phosphorus and calcium, leads to risk of bone disease and organ calcification. Patients often feel nauseous and lose appetite and experience worsening fatigue. Stage 5, kidney failure and stage renal disease. Okay, EGFR 15. Kidneys can no longer filter adequately. This is life-threatening without intervention. Symptoms include little or no urine, shortness of breath, gray-yellow skin hue, and nail changes. Requires dialysis or kidney transplantation for survival. Okay. This staging symptom applies to CKD regardless of cause, be it diabetes or rare conditions like LGA, nephropathy, LGAN. The article also emphasizes regular testing and individualized care planning, especially as the disease progresses. Would you like to explore how these stages inform treatment strategies, or how they intersect with conditions like LGAN or hypertension? You're great at drawing those conclusions or connections. Lifestyle choices play a pivotal role in either allowing or accelerating the progression of chronic kidney disease, CKD, especially in the earlier stages like 1 through 3. when there is still time to preserve function and prevent complications from the document you're working with. Stage 3 is even described as a critical window for here's how your daily decisions can shift the trajectory. 1. Nutrition. Low sodium, kidney friendly diets help control blood pressure and reduce fluid retention. Diets lower in animal protein and phosphorus can reduce kidney workload and limit mineral imbalances. DASH or plant-based diets are especially protective, even more so when tailored to the stage of CKD, blood pressure and diabetes control. Maintaining tight blood pressure control 130/80 can delay progression. For people with diabetes, managing AB or HbA1c below -7, individualized per patient is crucial. To avoid glucomolecular or glucomerular damage. Physical activity, regular aerobic and resistant exercise improves insulin sensitivity and cardiovascular health. Important since heart disease and kidney disease often go hand in hand. 4. Smoking and alcohol. Smoking accelerates kidney scarring and raises cardiovascular risk. Excessive alcohol consumption can raise blood pressure and burden the kidneys with toxins. Medication adherence. Using ACE inhibitors or ARBs as prescribed helps reduce proteinuria and preserve kidney function. Avoid over-the-counter NSAIDs is key. They can be nephrotoxic, especially in advanced stages. 6. Stress and sleep. Chronic stress and poor sleep affect cortisol and BP, indirectly harming kidneys. Mindfulness-based stress reduction programs have shown measurable benefits in CKD patients. By integrating these lifestyle changes, people with CKD, especially in stages 1 to 3, can not only stabilize their condition, but in many cases prolong the time before dialysis or transplant is needed. Your interest in practical evidence aligned with strategies really aligns well with this approach. Okay. I want to delve into how magnesium diet or even cognitive stress can affect kidney outcomes too. There are more synergy here than people realize. Great question, Felicia. And how? And one with more nonsense than most people realize. The effect of exercise. Most people intensely on kidney function depends heavily on a person's baseline kidney health, hydration status, and recovery mechanisms. In healthy individuals, moderate to vigorous exercise is generally beneficial. It improves cardiovascular health, insulin sensitivity, and blood pressure regulation, all proactive for kidneys. Transcend raise in creatinine and proteinula can occur after intense workouts, especially resistance training. But this is usually reversible and not harmful in healthy people. It reflects increased muscle metabolism and filtration stress. People with early to moderate CKD stages 1 to 3, moderate intensity exercise such as brisk walking, swimming, or cycling is ideal. It improves blood pressure, controls blood sugar, and preserves muscle mass without significantly stressing the kidneys. High intensity exercise like sprints or heavy lifting isn't off limits but should be monitored, especially for post exercise symptoms like prolonged fatigue or dark urine, which can signal uh, rhabdomyolysis, rhabdomyolysis, or overexertion. In advanced CKD, stages 4 and 5, exercise should remain low to moderate in intensity and tailored to individual capacity. Supervised exercise can improve physical function, reduce inflammation, and slow progression, even in dialysis patients. Strenuous exercise here may pose higher risk of electrolyte shifts, fluid imbalances, or blood pressure volatility. Key modifiers to watch: hydration. Dehydration during exercise can intensely worsen kidney function. Especially if baseline function is impaired. Okay, medication use. ACE inhibitors or diuretics combined with intense training may increase the risk of acute kidney injury. In short, exercise is almost always beneficial, but intensity and duration matter, especially as CKD progresses. The sweet spot lies in optimizing cardiovascular benefit without overwhelming the kidneys' function capacity, filtration capacity. Curious how this connects with magnesium, inflammation, or cognitive load. I'd love to thread those in with your current research. There's surprising overlap with what you've been exploring on stroke rehab and fatigue resilience. Hydration is a game changer. When it comes to kidney function during exercises, especially for anyone at risk of or managing chronic kidney disease, CKD, here's how hydration works as a protective factor. Maintains filtration efficiency. Kidneys rely on adequate blood volume to filter waste efficiently during exercise. Dehydration reduces plasma volume, which in turn decreases glom, glom, glomerular filtration rate EGFR temporarily reduces oxygen delivery to the kidneys, creating a hypotoxic environment that can stress renal tissue. Prevents acute kidney injury or AKI. In intense workouts, especially in hot environments. Or when paired with medications like NSAIDs or diuretics, even mild dehydration can raise the risk of AKI. This is particularly true if muscle breakdown, rhabdomyolysis is in play. 3. Helps manage electrolyte balance, kidney regulation, sodium, potassium, and calcium. And during physical activity, you lose these via sweat. Without proper hydration, the kidneys struggle to keep levels stable, which can trigger symptoms like cramps, dizziness, or even cardiac arrhythmias in vulnerable individuals. Reduces risk of proteinuria. Dehydration can accelerate exercise induced proteinuria, which may be temporarily in healthy individuals but could signal damage in those with CKD. Staying hydrated helps moderate these by lowering glucomerular pressure. 5. Enhances recovery and limits inflammation. Proper hydration post-exercise supports renal clearance of inflammatory byproducts, helping the kidneys bounce back and keeping systematic inflammation in check. Especially important if someone is already dealing with oxidative stress or inflammation in CKD. For people in stages 1 to 3 of CKD, staying well hydrated without overloading fluids. It is a smart move to preserve function in later stages. Fluid intake may need to be more carefully balanced with guidance of a healthcare provider. Given your interest in neuro rehab and systematic health, you might find it fascinating how even mild dehydration has cognitive consequences, something that compounds both renal and neurological strain during physical stress. Want to bridge those domains next? There's some compelling research that spaces uh, in that space. Staying properly hydrated during workouts isn't just about sipping water. It's about strategic way to protect your kidneys, optimize performance, and prevent injury. Since you're already thinking in these terms of how renal and systematic health intersects, here is a targeted guide to the best practices. 1. Pre-workout hydration. Aim for 16 to 20 ounce, about 500 to 600 ml of water 2 to 3 hours before exercise. If you haven't hydrated recently, drink another 8 to 10 ounce glass of water, 250 to 300 ml, 20 to 30 minutes beforehand. Include some sodium concentrating foods or beverages like broth or gelatin, salted snacks if you're prone to sweat heavily. They help your body retain fluid during exercise. General rule: 7 to 10 ounce, 2 to 300 milliliters every 10 to 20 minutes, adjusted for intensity, temperature, and sweat rate. For workouts longer than an hour or in the heat, add electrolytes, especially sodium and potassium, using sports drinks or electrolyte tablets to avoid hypoanemia, low blood sodium. Don't wait to feel thirsty. Thirst lags behind fluid need. Post-workout recovery. Weigh yourself before and after possible. For every pound, 45 kilogram loss, drink 16 to 24 ounce, 500 to 700 milliliters of fluid. Replacement: electrolytes and carbohydrates. if the session was intense or over an hour. Monitor urine color, light lemonade shade while hydrated. Watch for red flags, dark urine, dizziness, excessive fatigue, or muscle cramps can be early sign of dehydration. In people with CKD or at risk, don't overcorrect with excessive fluid. Balance is key, especially if fluid retention is a concern, since hydration touches every system from cognition to renal perfusion. Want to explore how high dehydration may interact with neuroinflammation or post-stroke fatigue. There's fascinating crossover with what you've been delving into around rehab and systematic inflammation. Let's make that connection. Absolutely. Hydration is one of the most underrated performance enhancers in both athletic and cognitive realisms. It affects its effects a ripple through nearly every system you care about, including renal function, brain resilience, and cardiovascular efficiency. Cardiovascular and muscle efficiency. Dehydration reduces plasma volume, which means the heart has to work harder to circulate blood. This leads to earlier fatigue, reduced endurance, and slower recovery. Muscles require fluid for proper contraction. Even slight fluid loss is as little as 2% of body weight can impair strength, power output, and fine motor control. Cognitive performance. Hydration status directly influences mental clarity, focus, and reaction time, especially relevant post stroke or in older adults. Dehydration can worsen effective function and exacerbate neuroinflammation, com, uh, com, compromising both rehabilitation and safety. Uh, thermal thermoregulation. Fluids help uh, dis- despite heat through sweat. Without adequate hydration, core body temperatures raises, increasing the risk of heat exhaustion or heat stroke. This is especially taxing for individuals with CKD or other chronic conditions where uh, thermoregulatory systems may already be strained. Kidney performance during stroke, during stress. Dehydration during exercise decreases renal perfusion, which raises the risk of transplant kidney strain or injury. Ideal practically in people with a compromised function. Okay, last page. 5. Hormonal and metabolic effects. Dehydration triggers a cascade of hormonal responses like increased um, vasopressin and cortisol that elevate blood pressure and impair glucose metabolism, both detrimental for long-term health outcomes. In essence, proper hydration amplifies psychological performance while protecting core systems. You've been investing kidneys, brain, and heart alike. Want to loop in how hydration interacts with magnesium levels or blood-brain barrier intensely. Next, that's another high impact thread in your systematic health web. Okay, so that is A for you. I'll be back on shortly with B. Give me a little bit for B, please, and I'll be back on with you.